Welcome to Healthy Living. I'm Lori Johnson. Thanks for joining us today. Our topic is pain management, specifically how to alleviate pain in the moment without having problems down the road like addiction or other problems. My guest is Dr. Jacob Teitelbaum, who is a pain management specialist and the author of the book From Fatigued to Fantastic. Dr. Teitelbaum, great to see you. Thanks for being here.
Lori, it's great to be with you and with our guests today because 1/3 of Americans suffer needlessly with chronic pain. Pain is optional. And today we're going to teach you what causes your pain and how to make it go away.
Well, you know, we see the headlines every day about how 90,000 Americans, actually more than that, are dying from overdoses from these opioid pain pills, which is 3 times more than in 1999 before these pain pills came to the forefront. And research published in the Journal of the American Medical Association showed people who are suffering from back pain did not have any better pain relief from these pain pills, these opioids, than over-the-counter medications. Now, we know there are issues with the over-counter medications, but at least they're better than the pain pills. Can you react?
Well, here's the thing. There is a time for the narcotic pain medications. If you have somebody who's in horrible pain from cancer, you want to give them whatever they need to be comfortable. And there are some people who have pain who need the narcotics. The vast majority don't. And this is what my research has shown. Lori, here's the key thing. People need to realize pain is not an outside invader. It's not like an infection. It's not like an outside injury where you get hit on the head or something. Pain is your body's telling you something needs attention. It's like the oil light on your car's dashboard. And if you give your body what it needs, the pain goes away. Just like if you put oil in the car, the oil light goes out. With back pain, you don't want to use Motrin-type medications or ibuprofen. They're associated with double the risk of the pain becoming chronic. You want to avoid narcotics. You want to use basic things. I'll use a mix of herbs. There's one called Curamin. There's another one called Curamin Low Back. Given 6 weeks, these things are wonderful.
Well, we know that the number one type of pain, the number one pain problem that people talk about when they go to see the doctor is back pain, specifically lower back pain. And we know that opioids are often prescribed, these pain pills for back pain. People get addicted to them, and their doctors no longer prescribe them anymore. Then they get them on the street, and then there's the fentanyl in them. And this is what causes these overdoses that we're seeing time and time again. So let's back up and talk about back pain, specifically lower back pain. If that's the engine light going on, what's the root problem?
It means that you need to increase your core body strength in your abdominal muscles. Most of the back pain is not coming from discs. Even if your MRI and X-ray looks like a war zone, that's normal wear and tear because we're an upright species. The problem is that the muscles are getting weak and they get sore. So there are core body exercises that can be done. You can look them up online. They're easy to find. You want to go ahead and address inflammation. So curcumin, but it has to be very highly absorbed curcumin, boswellia, which is another name for frankincense, very good anti-inflammatory. There's other DLPA nattokinase. So address the inflammation, address the weak muscles, find somebody who can teach you how to do the core body exercises. And if you have a big gut, it's time to trim that down a bit.
Easier said than done. When someone has, you know, the big belly, folks love the fast food. They love the sugar. We all do. What's the best method to get rid of that?
Well, number one, cut out the sugar. Like I say, ask any farmer. If you want to go ahead and fatten up an animal, you carbohydrate load them. So switch to more of like a keto diet kind of a thing, a higher protein, low carbohydrate diet. That way you're going to be satisfied. You can eat all you want. But the protein doesn't put on fat as much as the sugar and carbs do.
And when you say that people should lower inflammation, you listed off a few things, the curcumin and boswellia and some of the other things. Can you go over those again? Now, these are things that will help relieve pain and lower inflammation.
Absolutely. So I'm going to start with something called Curamin, Curamin, not curcumin, but Curamin. It's amazing for pain, but again, give it 6 weeks. But to decrease inflammation, you want to go ahead and again, decrease sugar, decrease white flour, increase the omega-3s in the diet, the healthy fish oils like tuna or salmon or sardines. Fried fish from the fast food place isn't going to do it. But these simple diet changes. If you're going to eat the meat, have it be the grass-fed meat instead of grain-fed meat.
Hmm.
Go with whole grains instead of white flour. All of these things shift inflammation back to being healthy again.
So there are certain foods that actually increase inflammation, and you're saying stay away from those and head towards the ones that decrease inflammation, like the fish. What about taking fish oil? If you don't want to eat fish all the day, some of us are concerned about the mercury content. I know salmon's okay. There isn't a lot of mercury in salmon, but tuna does. My doctor said not to eat tuna more than 2 times a week. Can you take the fish oil every day? Is that a good way to lower inflammation?
What I take each day myself is one called Vectomega, because remember, most of the fish oil pills are not made up of what your body is wanting, the omega-3s. It's made up of other kinds of oils that go rancid. And that's why you get these fish oil burps all day, and every cat in the neighborhood nose goes up like an infield fly going, what's that every time they burp? So I'll take one called Vectomega, where one a day replaces seven of these big honker fish oil pills. So the Vectomega 1 or 2 a day are brilliant at balancing inflammation.
So we talked very briefly about these NSAIDs, the non-steroidal anti-inflammatory drugs that we find over the counter. And so a lot of doctors are saying NSAIDs will handle your pain just as well as the opioids. So take the NSAIDs. But there are some issues with NSAIDs, especially as it relates to the gut. Can you go over those?
Well, you're going to take a look. Number one, NSAID has been shown to increase the risk of heart attack by 35%. Also, 4 to 16,500 deaths a year, depending on the research, from bleeding ulcers. Also causes leaky gut and food allergies and sensitivities. It translates to about 50,000 excess deaths a year. And if you look at the head-on studies, say for arthritis, if doing it for arthritis, glucosamine plus chondroitin has been associated with being as effective as Lexicab. But instead of the side effects, you get side benefits. You have a 22% lower risk of dying during the study period instead of 50,000 increased deaths. So I'll use something called B-Mobile, which has a mix of glucosamine, chondroitin, hyaluronic acid, other things. I'll use the curcumin together with that. And given 6 weeks, most of the people I treat, they don't need the NSAIDs anymore. Now, if you do, again, the NSAIDs, taking the ibuprofen is a lot healthier than being in pain. But I like to give, I'll leave them on their medication, add the natural things in, give it 6 weeks. Then, your pain's going to be going way down. Then you can go to the doctor and say, Doc, I feel so much better. Can I come off my medicine?
I love it.
And you're,
Yeah, I love it how you say, yeah, opioids are okay if you really need them. And now you're saying NSAIDs are okay if you really need them. A lot of folks may be confused. What exactly are NSAIDs? You mentioned the Motrin. What else?
The ibuprofen, Lexicab, naproxen, these are the common ones that you get over the counter. Not Tylenol. Tylenol, by the way, is much safer.
All right.
You're looking at a few hundred deaths a year instead of tens of thousands of deaths.
But Advil is an NSAID, and isn't also aspirin?
Aspirin is different.
Okay.
Aspirin has its own risks. Taking one aspirin a day for heart health, if you don't have a history of a heart attack, the research is showing that's as likely to kill you as help you.
So if you are in pain and you reach for an over-the-counter, you're probably better off taking Tylenol than Advil.
Absolutely.
All right, we're going to take a quick break and be right back with Dr. Jacob Teitelbaum, the author of the book From Fatigued to Fantastic. Stay with us. Welcome back to Healthy Living, and today we are talking about pain management with Dr. Jacob Teitelbaum. And Dr. Teitelbaum, you published some very fascinating research about pain relief for people suffering from fibromyalgia, where you showed that an integrative approach reduced their pain by 90%, and this is in 91% of the subjects. Can you, first of all, talk about fibromyalgia, what that is for our viewers who aren't really that familiar with it?
So if we talk about different oil lights on your body's dashboard saying something needs attention, if fibromyalgia, which is when you have widespread pain, fatigue, and insomnia, that paradox of can't sleep even though you're exhausted and you're hurt all over, that light, flashing light on your body, is saying you have an energy crisis that's going on and you've tripped a circuit breaker because of low energy. And all kinds of things, viral infections, we're seeing post-COVID, it's just post-viral chronic fatigue syndrome, severe stress, anything that triggers insomnia, nutritional deficiencies. All of these things can cause an energy crisis. And our research showed that when you restore energy with the SHINE protocol, addresses sleep, hormones, infections, nutrition, and exercise as able, the energy goes back, the circuit breaker goes back on, and the fibromyalgia goes away. And I know because I had this myself. It knocked me out of medical school and left me homeless back in 1975 after a nasty viral infection. So I learned firsthand what I needed to do to recover.
Wow, so many millions of Americans right now are fatigued, and it could be the post-COVID. Some people call it long COVID. They're saying the number one symptom is fatigue. So this protocol could help them. You call it the SHINE protocol. The first one is sleep, but you said a lot of people have difficulty sleeping. How do you get that sleep?
Well, there are many herbals. Revitalizing sleep formula is one good one. Terrific ZZZZ, EP 120, 10 milligrams sustained release melatonin. All of these are a mix of different natural things that will leave most people sleeping like kittens. And again, it's okay to use certain medications, but I'm going to go naturally first. Very low doses of trazodone, Elavil, Flexeril, tiny doses can help sleep with no addictive issues at all. So you can get your sleep. I mean, in the thousands and thousands of people I've treated, I can count on my fingers how many have not been able to get their good solid sleep each night. So if you feel like there's no way you can get sleep, there is a way. And you just want to use a mix of low dose natural things and maybe a few medications in severe cases.
Well, I noticed exercise is one component of the SHINE protocol. And of course, exercise does help one sleep better. What types of exercise? How often does a person need to exercise a day? Do they need to lift weights or do cardio or yoga? What do you recommend?
Yoga is very good, but start with walking, because if you push the exercise too much, you're going to get post-exertion malaise. You'll be bedridden for 3 days with fibromyalgia. See how much you can do comfortably, slowly increase it, maybe 50 steps every few days. But again, listen to your body. When it gets to the point where your body says that's too much, ease back. But with the SHINE protocol, your energy production, whether or not you have fibromyalgia, will be skyrocketing. And in 8 to 10 weeks, you'll be able to condition. And then you just keep increasing the walking by 50 steps every couple of days until you get to a mile or two a day. Then you can increase the intensity.
And you talked about nutrition. What all does that entail?
Well, it's funny. We did one of the studies we've done 4 studies on post-viral fatigue in the last 2 years. And one of the studies showed that using a special form of ginseng called HRG80 red ginseng, it needs to be that form. And I like the chewable tablets because that's much more cost-effective for people. It's not expensive. Dramatically increased energy and stamina on the order of like 70%, while bringing pain down quite a bit as well. So that simple thing, a good multivitamin, and I'm not impressed with most of them, but one that's high in B vitamins and magnesium. I like a powder called the Energy Revitalization System, where one drink, that's what I take myself, replaces over 50 pills each day. It just covers the whole gamut and optimal levels. So the Energy Revitalization System, if you don't like powders, clinical essentials, very easy. But the B vitamins and magnesium, critical for energy, critical for pain relief.
You know, I find it really amazing that so many people, especially my peers, women who are, you know, of a certain age, let's say it that way, who just suffer in silence. So many people think it's just natural or somehow unavoidable to just be tired all the time. How many millions of women does this affect?
31% have severe fatigue. 4% have fibromyalgia or fibromyalgia-related processes in most severe form. But everybody wants more energy. And I'll tell you a simple three-step thing. You know, we talked about cut back the sugar a little bit. Stevia is a good natural sweetener. Chocolate is a health food, by the way. Go for quality, not quantity. But what I do myself, energy revitalization system vitamin powder, an HRG80 red ginseng chewable each morning. And then there's a third, the Smart Energy System, which is a mix of 6 nutrients and herbs. Most people, those three simple things can double their energy in less than 1 minute a day. And this is healthy energy, not loan shark kind of energy like most of these things are.
Right,
This
right.
gives you a healthy energy that you need.
Understood. Well, the book is called From Fatigued to Fantastic. Doesn't that sound great? The author is Dr. Jacob Teitelbaum. We're going to take another break and be right back on Healthy Living. We're back talking with Dr. Jacob Teitelbaum, and I wanted to talk about type 2 diabetes with you. And, you know, a lot of folks who have type 2 diabetes, and this is growing, it's at epidemic levels, really don't think that there's anything they can do about it except take the insulin, which is expensive and does have some side effects. But you say, no, you can actually reverse type 2 diabetes and not even have to be on medications anymore. Isn't that great?
That's what the research shows. Over 85% of people can make their diabetes go away. And diabetes is optional. Lori, it helps to know that if you go back 500 years ago, adult diabetes was exceedingly rare. It was, you know, almost reportable kind of thing. You didn't see it. It was only with a modern diet of high sugar, high white flour, and being couch potatoes that we're seeing this epidemic. So there are natural things that you can do. And again, if you need the insulin, fine. But I use insulin more for children. It's a different kind of diabetes. In adults, it just makes them pack on the pounds. So I'm going to go with metformin first if I need a medication. But there are two natural herbals that are wonderful for lowering blood sugar.
And then there's this condition called metabolic syndrome. Again, we're seeing an explosion of metabolic syndrome in the United States. A lot of people who have it don't even know what it is. Can you describe that and what you can do for it?
Basically, when your body becomes deaf to insulin, called insulin resistance, and your insulin levels are skyrocketing, which is why I don't use insulin very much in adult diabetes, it makes the body more and more deaf. You're going to see not only diabetes, but cholesterol goes up, blood pressure goes up. You're going to see this kind of what's called spare tire around the abdomen. You're going to pack on the pounds. And the answer isn't to give a cholesterol medicine and blood pressure medicines, although blood pressure medicines are life-saving. If you have high blood pressure, you want to increase potassium, increase magnesium, add some vitamin D, and take the blood pressure medicines. I'm not a big fan of the cholesterol medicines if you've not had a heart attack. If you have had a heart attack, absolutely take them. But if you just get your body to be able to hear the insulin, there's two herbals. One is called Sucontral D, Hintonia, very effective at lowering the blood sugar and optimizing it. Another one is berberine, and the one I use is berberine Met X. There's a nice high absorption one. So it's just 250 milligrams twice a day of that form instead of the 1,500 milligrams that upsets the stomach. But you're going to find over the 6 to 12 months, each one of those brings down the blood sugar levels, often will make to normal, to healthy, even in people with diabetes. So cut down the sugar, cut down the white flour, go more of the protein, and go for your exercise. Magnesium helps the metabolic syndrome as well. Low magnesium, even if the test is normal, equals metabolic syndrome risk. Low vitamin D increases metabolic syndrome. Simple things you can do. Diabetes truly is optional.
Well, this is fantastic information. We're going to take one final break and be right back with Dr. Jacob Teitelbaum. Stay with us. Welcome back to Healthy Living, and we are continuing our discussion with Dr. Jacob Teitelbaum. In the last segment, Doctor, you mentioned you're not a huge fan of the statin drugs, the cholesterol-lowering drugs. Why are you not in favor of them if you haven't had a heart attack? You like them if you have had a heart attack. Then also, what should people who have really high cholesterol do who haven't had a heart attack yet?
What the research shows is that in the absence of having had a heart attack, just treating a high cholesterol, and let's say if you're under 300, under 280, it decreases heart attack risk 2%. Let's give some perspective. Eating a little square of chocolate each day, not a lot, a little bit, is associated with a 45% lower risk of heart attack. Owning a cat is associated with a 30% lower risk of heart attack. All these different things. And the statins, they try to make believe it doesn't cause side effects, but I see these people coming in with their fibromyalgia from it. Now, if you've had a heart attack, it is definitely life-saving. Stroke, heart attack, be on it. But otherwise, I'm going to give Sylvan red rice yeast. And again, the brand matters. The Sylvan is one that I'll tend to use. More effective than the statins. I'm going to use the berberine Met-X. Helps insulin sensitivity. That's going to bring the cholesterol down. Go for some walks. And again, avoid the sugar. Simple things make all the difference. Now, also, I'm going to mention, make sure your thyroid is okay. And the blood test won't tell you. See a holistic doctor. And in men, when you're starting to see low testosterone, sexual dysfunction, spare tire around the abdomen, a lot of that is low testosterone, even if the blood test is normal. And just like women go through menopause, men go through menopause where they need the bioidentical, not this poison stuff, but the healthy bioidentical forms. And that will often bring the cholesterol and the diabetes down as well.
Well, I'm sure the people who are watching this show today are trying to furiously write down or remember all the different supplements and things that you've been talking about. Where can people find out all this information and find out more about you and where to get your books?
Most of what we talked about today, especially all the different kinds of pain, the fibromyalgia, and even the diabetes, are discussed in my book, From Fatigued to Fantastic. Find that on Amazon, any bookstore. Two websites for information, vitality101.com. The supplements we talked about, you can find pretty much anywhere. The endfatigue.com, E, and like Nancy, D like David, fatigue.com will have the main supplements that I find helpful for people.
All right, Dr. Jacob Teitelbaum, thank you so much for being with us today. Always great to see you. We appreciate your time.
Likewise. Be well, everybody.
And thanks to you for joining into this edition of Healthy Living. I'm Lori Johnson, and we'll see you again next time. Bye now.